when there is infection here in this lower urethra, then we call it the lower urinary tract infection. Lower urinary tract infections. So when these infections reach the bladder, urinary bladder, and then we call it the cystitis. And when these infections goes upwards and then it reaches the kidneys, then it called the pyelonephritis. Okay, pyelonephritis. So UTI can be pyelonephritis, it can be cystitis, it can be lower urinary tract infections, or it can be all together. Okay, so that's what comes to the urinary tract infections. So most of the time it's all three together, because urinary tract usually infections in the UTI, it is usually ascending infections. It starts with the vaginal infections, then urethral infections, bladder infections, urethra infections, going up to the kidney. Okay, so that's why it's all together. Most of the times it's all together, right? So what else you have to remember, that urinary tract infections, it may be asymptomatic most of the time, not most of the time. 10% cases are asymptomatic. Okay, 90% cases are symptomatic. So sometimes it is asymptomatic. Asymptomatic means they are not producing any signs or symptoms. Okay, what we call as asymptomatic bacteriuria. So what is the common thing between asymptomatic and symptomatic? That in both the cases, when you see the urine report, you'll find WBCs. You'll find inflammatory cytokines. Sometimes you can find RBCs also showing hematuria. Okay. Just the only difference is that, as the name suggests, asymptomatic, they don't have any sort of pain, or the clinical features will be absent, which we'll discuss later on. Okay, but common thing is that in both the situation, you can find this urinary report. Means asymptomatic bacteriuria, we commonly call as ABU. So UTI patient we divide into ABU, asymptomatic bacteriuria, or symptomatic cases. Right? Asymptomatic means most of the time they are accidentally discovered. Okay, they will go for checkup and urine report comes as there are heavy infections, like white blood cells are there, pus cells are there, or inflammatory cytokines are present in the urine. Okay, so let's first now understand the risk factors. So what are the risk factors of UTI? What are the risk factors of UTI? Number one, it is one thing, female are more prone to UTI than male's counterpart. Okay, so females are in more common thing than males. Now why? As I already discussed in the last class, the females have one thing, they have shorter urethra. Okay, they have shorter urethra. And second is that also there is some social issues. Like female cannot pee everywhere, they cannot empty their bladder everywhere, they need space, they need time, and they need proper privacy. Okay, so most of the times females, while traveling or while long flights, they are often holding the urine. So every time there is urine holding in the bladder, what we call stasis, there is chances of developing infections. So more amount of urine is holded, more is the always chances of getting infected and causing UTI. So that's why it's common in female. Anatomically they have shorter urethra. Second is the social or psychological issues because of lack of space, lack of privacy. Sometimes they have to hold the urine for a long time. That also is a case that more in females. Third is the pregnancy. During pregnancy, as you know, bladder is most often the time it's compressed by the growing uterus. Okay, like in pregnant, we know anatomically, we know that this is if this is the bladder and this is the uterus. So uterus is always compressing the bladder, right? Anatomically it is like that, from the sideways. So when there is a growing fetus in the uterus, so for the first 3 months it will compress the bladder. So that's why there is increased frequency of micturition in pregnancy, in first few months of pregnancy. Because as the pregnancy continues and uterus grows, then it suddenly, So this is the bladder. Uterus is always pressing the bladder. So after 3 months, uterus becomes straight. Then this complaining of more and more passing of urine usually fade away. So it is more prominent in the first few months when the growing uterus is constantly pressing the bladder. So anyways, it constantly pressing the bladder. The problem is that there is incomplete evacuation of bladder most of the time. Okay. Problem is that any situation when the urinary bladder is not emptying completely, it means what? There is collection of residual urine. So as a result, there is multiplication of bacteria. That is one thing. Another thing is that whenever most of the sometimes oral contraceptive methods, okay, female mostly during contraception methods, okay, contraception is a different topic, we'll discuss in some other class. So females usually take pills, or some females they prefer diaphragmatic cap, which is being put into the vagina. Diaphragmatic cap. So this is also one type of contraceptive method. So any sort of artificial thing or foreign element present in the vagina, it can also increase bacterial growth. And we know this is vaginal opening and this is urethral opening. They are not so distant, they are close. So any infection here can usually migrate here. Okay, then it can cause infections and gradually to the bladder also. Okay, so any sort of this type of contraceptive method where females are putting diaphragmatic cap in their vagina or during pregnancy, they are more vulnerable. So overall, females are more prone to UTI than males. But it's not that males are not having UTI. Males also do have UTI, but very commonly after 50 years of age. So males are more common in after 50 years of age. Now why is that? Okay, anatomically, if you see, this is the urinary bladder and this is the urethra. So at the junction of this urinary bladder and the urethra here, there is a prostate gland, as you know. There is a prostate gland. Okay, so this is prostate gland. So literally in males after 50 years of age, every male, I'm telling you that, every male has a tendency of enlargement of this prostate gland. The prostate gland literally enlarges. Okay, what we call, it's not a tumor. We call it as a benign prostate hypertrophy. And it is almost physiological in males. So every males after 50 years of age, they have some kind of the prostate gland enlarged. Now prostate gland is enlarged, it is encircling the urethra like this. So in any situation when prostate gland enlarged, is also because it also enlarged from the interior side also. So in any situation when the prostate gland enlarged, it will compress the urethra. So when you are compressing the urethra tight, there is always difficulty in passing. There is always difficulty in passing urine. So that's why every 50 plus males do have problems in passing urine. They wake up frequently at night. Okay, why? There is because prostate gland is enlarged in every male. In some people, they enlarge is more that they have to go up for the surgical treatment, and some it is less, but they do have urine passing problems. Okay, so this is the counterpart in gender issue. Now, what are the other risk factors? Now, other risk factors is multiple sexual activity, or new partners in females especially. Okay, so any sort of multiple sexual activity or new partners always increase the high risk of UTI in females. Okay, so every time there is a sexual activity, then there is some bacterial invasion over the vagina. Okay, now females do need to maintain a normal hygiene, personal hygiene, what you say, and it is said normally it is a concept that every time there is a sexual intercourse, females must empty their bladder, because that emptying of the bladder after the sexual intercourse, it tries to wash out of any bacteria coming towards the urethra. Okay, as I told you, this is the vaginal opening. Okay. Okay, this is the vaginal opening, and this is the urinary bladder, urethral opening. Okay, urethral opening. So this is vaginal urethra, this is urethral opening. So with every sexual intercourse, there is some chances of bacteria coming near the vaginal opening, and there is some chance of going towards this side. So maintenance of that is personal hygiene, like taking shower and passing or emptying the urinary bladder after sexual intercourse, also protects the females from developing rapid UTI. Okay, UTI. So multiple sexual partners is one cause. High sexual activity is one cause, and new partner, every time they are getting a new partner, that is also one cause of UTI. There are also risk factors, and plus any history of STD. Okay, any sexually transmitted disease already present, that is also a risk factor. These are all risk factors for developing UTI. What are the other risk factors other than which is both common to females and males is diabetes. Whenever there is diabetes, we know there is depression of our immune system. Immune system is especially the cytokines, they are quite depressed. They goes down level. So that's why in diabetes, that's why it's very, very common to have urinary tract infections. Again, coming back to the females, menopause is one situation when there can be UTI. What is menopause? When the menstruation stops completely in female. So every female has a reproductive life. We'll discuss this in the next class. So they have, so in every female's reproductive life, around 45 to 50 years of age, the menstruation ceases. There is no menstruation. So what we call as menopause, means pause to the menstruation. So it occurs in around the range of 45 to 50 years of age. So what happens in menopause? There is down level of estrogen hormone. Okay, so whenever the estrogen hormone goes down, the female vaginal tract, the genitourinary tract, it becomes very, very affected. It becomes dry because estrogen is protective. So when the estrogen level goes down, there is chances of developing UTI in postmenopausal women. Okay, that is number 5. Number 6 is any alteration of the vaginal flora. Any alteration in vaginal flora. Now what does it mean? Normally, now let me draw this uterus. Okay, so this is here, there is a vagina, this is cervix, this is uterus. Okay, so normally in the vagina, normally here, there is some eco-friendly bacteria, there is some bacteria. What are these bacteria? They are lactobacillus. So they are normal vaginal flora. These lactobacillus are normally present in the vagina. And what these lactobacillus are doing? They are secreting lactic acid. So this lactic acid is keeping this vagina in an acidic environment. So due to this acidic environment normally present in the vagina, the harmful bacteria cannot grow. Okay, that is one thing. Another thing they are secreting, this lactobacillus they are producing is hydrogen peroxide, H2O2. This hydrogen peroxide is so toxic for the other organism that it always dominates the yeast. Normally in the female vaginal flora there is a balance between the yeast and the bacteria. Okay, so because of the constant production of hydrogen peroxide by the lactobacillus, it dominates the yeast and don't let the yeast grow. Because if the yeast still grow, the female will complain of white discharge, that we know, white vaginal discharge. Okay, so this lactobacillus they protect. So in any condition when these lactobacillus are killed or this lactobacillus level goes down, just for example, sometimes when there is injudicious use of antibiotics, when antibiotics are not needed, but sometimes there is prescription of overuse of antibiotics, whatever it be the cause. So when there is overuse of antibiotics, these antibiotics, they not only kill the other bacteria, they also kill the lactobacillus. Lactobacillus is a bacteria. So overuse of antibiotics can damage the lactobacillus and damaging of or killing the lactobacillus. And when the lactobacillus are killed, then this protective layer is gone, and as a result yeast level goes up and there can be white vaginal discharge in the consequence. So often when patients come with white vaginal discharge, the first thing we ask, have you taken some antibiotics just 1 or 2 weeks before? Because any such sort of history, when females are taking lot of antibiotics, what they're doing, they're killing their vaginal flora and they're having white vaginal discharge. Now when this, white vaginal discharge is there, but what is happening here? Here is what's happening, this flora is going down. So the protective layer is going down. As a result, bacteria can multiply. These bacteria can multiply. And as I told you here, so this is the bladder with urethra. Okay, this is the bladder with urethra. So if the bacteria will multiply, very soon this bacteria will migrate to the urethra also, and there will be ascending infection causing lower urinary tract infection or cystitis, or to the kidneys to pyelonephritis, because they are close. This is the vaginal opening, this is the urethral opening. They are close. So any infection here can quickly go here. So any change in the vaginal flora, that's an alteration in the vaginal flora, due to whatever be the cause, injudicious use of antibiotics, or due to whatever be the cause, when this lactobacillus is down, it goes up, it cause white vaginal discharge, that is different story. But if the lactobacillus goes down, harmful bacteria will multiply. It can cause vaginal infections, but that is a different story. But when there is a vaginal infection, there is always a chance of UTI, urinary tract infection, because bacteria can go here also. Okay, it can quickly migrate and can cause UTI. That is also one cause. There is also risk factors other than that. And next is any sort of history, past history. So if a patient has a past history of UTI, he or she always have a double chance or 20-30% chances of developing UTI in future. Remember, every female has in their life, they have a 99% chance they go through a stage of UTI. So after every episode of UTI, there is a chance that they can develop UTI again in future, because there is now the root has been established. So there has to keep proper hygiene and all the taking lot of fluids, all those things. We'll come to that part later. So these are the risk factors in basically for urinary tract infections. Okay. So what are the causative organisms now? Going to the pathogenesis, what are the causative organisms? Okay. So you should know what is the microbiological organism or causative organisms. So most common bacteria for urinary tract infections is E. coli. Most common bacteria. Why E. coli is most common? Because E. coli bacteria has a particular thing. They have some adhesive proteins, surface adhesive. So these surface adhesive proteins like pili and fimbria. So because of these qualities in this particular E. coli bacteria, they can adhere, they can hold to the urinary tract. They can hold to the bladder, they can hold to the urinary tract so firmly that even the flushing urine cannot wash them away most of the times. Okay, they are attached to it so frequently. And plus this E. coli is as a normal thing, a normal bacteria present in the GI tract. So the invasion is very, very fast. So invasion can be quick coming from the GI tract, they can always invade the urinary tract. Okay, so E. coli is the number one bacteria, then Proteus, then Staphylococcus, Saprophyticus. So just the names, you have to remember the names, then Klebsiella, Enterococci. So these are the basic bacteria that are responsible for urinary tract infection, but you need to remember the most common bacteria is E. coli. And the infection is always ascending type. Sometimes only it can come from the blood, from the hematogenous route. It can come directly from the blood, and only happens when there is some aggressive bacteria that has come to the capillaries, and from the capillaries it has directly invaded the urinary bladder or the kidneys or the urinary tract. Normally it always goes through from the vagina to the urethra, to the bladder and to the kidneys. But sometimes, rarely, when there is Staphylococcus aureus, which is very aggressive, and Salmonella species, they can come directly from the blood and causing UTI. Okay, so these are the particular bacteria causing UTI, right? Now let's quickly understand the clinical features, how the patient will present. clinical features. Okay, so as you know, so this is the kidneys, wait, and they come to the bladder, and then urethra. So we know this is lower urinary tract infections. Lower urinary tract, this is cystitis, this is pyelonephritis. As I told you, it is most of the time it is in this fashion. It will reach here, reach here. So whatever be the cause, any cause when there is urinastasis, when urine is blocked, not going out, okay, then like in any case, whether it is kidney or bladder stones or any foreign element, which I forgot to mention, any foreign element, like sometimes we have to put catheter. It is also a risk. So you are putting a foreign element here. So there is high chances of bacteria over the catheters. Sometimes there is stone. That is also a risk factor. Any stone, that because it is blocking the urine flow. Okay. Or neurogenic bladder, when there is spinal cord is damaged. Neurogenic bladder. Any trauma to S1, S2, S3, as you know, this is a micturition reflex. So when the bladder cannot empty, these are all also the risk factors. Now, what are the clinical features? So as we go up, the clinical features will change. It will add up. Okay. So from here, you see, when there is a lower urinary tract infection, what will happen? There is patient will say there is a burning sensations. There will be burning sensations while passing urine. Plus, there is increased urge to urinate, increased frequency of passing urine, of micturition. Okay, increased frequency of passing urine plus burning sensations. It is saying that this is a lower urinary tract infections. Okay, so as the bacteria will climb high and reach the urinary bladder, and we call it as a cystitis, and as when the bladder is involved, it will now come with, along with this plus burning sensation plus increased frequency of urine, there will be pain. Where will be pain? Pain lower abdomen. Pain in the lower abdomen. Okay, especially the suprapubic area. Okay, pain in the lower abdomen. This is okay. This is umbilicus. So pain in the lower abdomen. Pain here in the lower abdomen. There will be pain. So when there will be pain, burning sensation, increased frequency, it means it's a case of cystitis. It's no longer a lower urinary tract infections. And most common presentation of cystitis is always, most of the time, 48 hours after sexual intercourse. There is high chances of developing cystitis if the personal hygiene is not maintained. Okay, remember that. Okay, that's why sometimes in the cystitis you have to ask the patient history. You have to ask the patient history if there is any incidence of sexual intercourse 48 hours before. Okay, you have to ask that cases. So whenever after sexual intercourse the personal hygiene is not maintained, then it can cause cystitis. So when cystitis is involved, there will be pain lower abdomen, means around the bladder area there will be complaining of pain. Now as these infections will go up, as the infections is going up, bacteria are now multiplying and going up towards the bladder and causing pyelonephritis, then comes fever. Alright, and flank pain in the sides, flank pain. Okay, fever and flank pain in the side of the abdomen, not below the umbilicus or the lower abdomen. Pain mostly over the kidney areas, over the side areas. And the fever will be most like, there is a particular kind of fever which is called picket fence fever. Okay, it's called picket fence fever. So what type of fever is that? It's called picket fence. Picket fence. So like the fence, okay. So how do you understand this picket fence? Now if you see the picket fence diagram, the fence is like this. So means the fever will go high and very soon it will go down after sweating, and again it will go high, and after some time patient will sweat a lot, again it will go down. So it will be like a picket fence, irregular and up and down. Okay, that's why it's called picket fence. And remember, before fever, in cases of UTI, patient will always feel very cold and then he'll shake. That is called chill and rigor. He will have chill, then plus rigor, and then he will have fever. So this is the characteristic case of UTI. Characteristic case of actually pyelonephritis. plus all the other symptoms. It is not that patient is only having chill and rigor and fever. That is not UTI. Patient will have chill, rigor, followed by fever, plus bladder symptoms like plus signs and symptoms of cystitis, plus increased frequency of passing urine, burning sensations. All those things together, there is cystitis plus lower urinary tract infections plus fever plus flank pain. That suggests this is a case of pyelonephritis. This is the case of urinary tract infections. Okay, urinary tract infection, when you say, it is always, we mean that this is symptomatic, not asymptomatic. This is symptomatic urinary tract. Okay, so these are the things that are in the clinical features. So every time you get a patient, you need to ask a clear history, okay, and study the temperature charting. So every time temperature charting, you see the fever is very high today in the morning, by evening it's okay. And after 2 days, patient again came with a high fever. Again, he stayed for 4 to 5 hours, again went down. When it is happening rapidly, or means after a period of interval of time, you have to ask the patient, are you having burning sensation in the urine? Patient will say yes. You can ask about the sexual history. You can check for other STDs. Okay, if it is male, you have to check the prostate. You have to find the root cause of the disease. So whatever it is, these things are always signifying towards urinary tract infections, right? Next, going to the diagnosis. How do you diagnose? So how do you diagnose a case? First, most of the important thing is the clinical history. You will take a detailed clinical history. Any sexual exposures, any new partners, any multiple partners, whatever it is. You will take a detailed clinical history, or what are the fever type. Is the fever coming and going? Is it feeling cold? This type of particular leading questions you have to ask the patient. Okay. Sometimes job profile is also important. Sometimes people are in that type of job profile that they don't get enough chance to drink water, or they are working in a hot and humid climate, so they are dehydrating a lot. So in those cases also, when there is less water input, there is also chances of urine is concentrated, right? And then there is chances of getting UTI. Next is you will go for urine analysis. So you'll ask the patient to bring a urine sample. In any case of UTI, or any situation when you are asking the patient to give a urine sample, remember the urine sample should be the morning sample and midstream urine. Morning sample and midstream urine. The sample should be morning sample, the first morning sample, and let the urine pass a little bit, and then you take the midstream urine sample. That should be the sample. Then this urine sample should be analyzed, and you will see what you will see in the microscope. You will see plenty white blood cells. Okay. Sometimes, rarely, there can be hematuria also in UTI. In pyelonephritis, you can see sometimes there are RBCs. You can see some pus cells. So all these are signifying that it is UTI. Plus, you can also measure the urine pH. So normal urine pH should be less than 8. But when the pH is going because urine should be acidic. But when the pH is increasing, that is going above 8, it is signifying UTI. Okay, that is also a significant diagnostic point for UTI. So clinical findings, then history, urine analysis, or urine culture. When you are culturing the urine, so in urine culture, you give the sample to the lab and they will culture it. It will take a week. They will culture it in a lab, proper lab, and they will see which bacteria is present there. So they will find the colonies, whether it's E. coli or Klebsiella or Proteus, whatever. So more than 10 to the power 3 colony forming unit, this much bacteria present in the urine suggests of UTI, because normally there are bacteria present in the urine, and that is not UTI. Okay, but when you will see more than 10 to the power 3, that is suggesting of UTI. And as the UTI progress, it is 10 to the power 5, 10 to the power 6, means UTI, urine bacteria will increase more and more, right?